morning, good afternoon, good evening to the veterinarian from the different region in the world. You are welcome to Sri Lanka Veterinary Association second international webinar series opening ceremony. We have organized 16 webinars at this second SLVA international webinar series. Our resource persons are well-reputed veterinarian in Sri Lanka, USA, United Kingdom, and Australia. This time also we have included webinars on companion animals, farm animals, horses, elephant, swine management, and poultry health and management. Our first webinar series successfully completed with 280 webinars, which was a resounding success. I would like to request from you all to subscribe SLVA YouTube channel and click the bell icon to receive the notifications. Without wasting much time, I would like to invite Sukanta Malavarachi, the President of Sri Lanka Veterinary Association, to welcome you all. Dear President, over to you.
Yeah, very good evening to everyone. Very good evening to all the members of Sri Lanka Veterinary Association, past president.
Yes, President.
Mr. President, I can't hear you.
Dear President,
Hope you can hear now, no?
yes, President, yes, we can hear you.
All right, okay. Sorry for the technical error. Yeah. Again, I'll start from the beginning because I just lost my connection. Very good evening to all the members of Sri Lanka Veterinary Association. Especially today is a very important day for Sri Lankan and also to the world mothers, because today is the Mother's Day, International Mother's Day. I wish all the best for all the mothers in the world and also participating this session. And actually today is the first session we are going to start as Sri Lanka Veterinary Association 74th Executive Committee. And it is very interesting because it has been open to the world, and most of the doctors who are joining from other region also are there in our participant list. And I'm really thankful for all the members and welcome everyone to this session, especially members of Sri Lanka Veterinary Association and past president, teachers, and all the foreign who are joining from different regions, countries in the world. So again, I'm welcoming you all. And our guest speaker is Dr. Eranda Rajapaksha. He's a well-known teacher. He was a teacher at the University of Peradeniya. Now he has been started his own business, and I am sure that he will conduct very interesting session. And again, I just wanted to mention that there is a saying: the most important doctor in the world is veterinarian, because it says that veterinarian can't ask what is the matter from his patient. So I think everything we got to know. So that is important, because if you know the behavior of animal, then you can identify the illness first and then go for further details. So to talk about that, our guest speaker, Dr. Eranda Rajapaksha, is ready. And I welcome you, Doctor, for this session. And before that, we have a ground condition that will be explained to you by the moderator. And thank you very much again and welcome all the members to this session on this Sunday. I know that you are having your personal commitment, but despite that, you are joining this session because knowledge is very important. And our objective of SLVA is to disseminate the knowledge among our members for their benefits. So thank you, and also welcome to the session again. I pass this to Dr. Again, Sugat, to continue. Thank you. All the best.
Thank you very much, dear President. Now I would like to invite our moderator today, Dr. Chandika Wickramasinghe, reputed veterinarian in Sri Lanka. Dear Dr. Chandika, over to you.
Thank you, Dr. Sugat. So again, on behalf of the SLVA, I would like to welcome you all for the lecture. So today's lecture is on behavioral disorders in pet animals, done by Dr. Eranda Rajapaksha. So the plan for today is there will be a 40-minute lecture, then followed by a Q&A session. And for the Q&A session, you can ask live questions using the Zoom platform, or else you can like send your questions chat to the chat box so that we can incorporate those also into the discussion session. And also I request you to keep the microphones in mute mode so that we can have an uninterrupted session. So a word about Eranda Rajapaksha. He's a veterinarian graduate from the University of Eranda. And his specialties include applied
Dear Dr. Chandika,
Diplomate of American College of Animal Welfare, as well as a
Dr. Chandika, your voice is not available.
Dr. Sugat.
yeah,
I think that Chandika is having a problem in his internet connection.
yes.
Until he comes back, shall I introduce Dr. Eranda?
Yes, that's good.
Yeah, then he can start the session.
Yeah.
Yeah, let me introduce Dr. Eranda Rajapaksha. Dr. Eranda Rajapaksha is having BVSc, MS, PhD, DACAW, DACBB. He's a veterinarian and a former senior lecturer in Sri Lanka. His research and teaching are focused on applied animal behavior, animal welfare, and human-animal interactions. Dr. Eranda Rajapaksha received the BVSc degree from University of Peradeniya and MSc in Applied Animal Behavior and Animal Welfare from the University of Edinburgh, Scotland. Dr. Eranda Rajapaksha completed his clinical residency in companion animal behavior and his PhD on dairy cattle welfare at UC Davis. He is a Diplomate of American College of Animal Welfare and American College of Animal Behavior. His research studies in Sri Lanka include development of welfare parameters for dairy cattle, application animal-assisted therapy in geriatric and disabled care centers, and human and animal conflict, issues pertaining to elephants and monkeys. Dr. Rajapaksha has a keen interest in One Health education, and he has coordinated the field course on One Health between the University of Peradeniya and UC Davis. He was the secretary of the Sri Lanka Veterinary Association in 2015 and is a member of Sri Lanka Veterinary Council, which is the regulatory body of Sri Lankan veterinarians. Dr. Eranda was a senior lecturer at Faculty of Veterinary Medicine and Animal Science at University of Peradeniya for 14 years and was the former head of department at Department of Clinical Science. At the moment, he is the managing director of Rover Veterinary Hospital Private Limited, Battaramulla, Sri Lanka. Next, I would like to invite Dr. Eranda Rajapaksha to continue the Zoom session. Over to you, Dr. Eranda.
All right, thank you. I hope everybody can hear me.
Yes, we can hear you.
Let me share the slides. Right. Dr. Sugat, is it okay? Can you all clearly see the slides?
Yes, we can see the slides. Yes, thank you.
Right, okay.
Dr. Eranda, can you make it to the presentation mode?
Okay, now it's working. Perfect.
Yeah, now okay.
Right, okay. Thank you so much for inviting me today. And I want to make a small correction to the introduction. I mean, I was a member of Sri Lanka Veterinary Council, but not at the moment. It was in the past, okay? So, so today we are going to discuss about behavioral disorders in pet animals. And I thank SLVA for inviting me for this session. So before we start, since we have quite a big group and from diverse people, I want to start with a small, let's call it a game. I want you to follow me with the same prompts that I'm giving you. Just it's a simple math game. Let's see how we all do it. Okay. So think of a number between 1 to 9. All right. And multiply that number by 9. Okay. So if you have a 2-digit number, bring it to a single-digit number by adding them together. Okay. And then subtract 5 from that number. So now all of you should have a number in your mind, right? If you are good in basic maths. So then think of a corresponding letter in the alphabet to that number. So say if your number is 3, then your letter is C. So think of a country starting with the letter that you have. Then think of an animal, starting from the last letter of the country's name. Okay. And this is the last one. Think of a fruit starting from the last letter of the animal that you have chosen. All right. So all of you should have now a name of a country, and an animal, and a fruit. So how many of you got this one? Denmark, kangaroo, and orange. And if you have any other choices, please write it in the chat box so I will know what are the different thinkers we have. So this is a very common thing, you know. We all think based on our knowledge and then the experiences we have. Let's see how many of you have different choices than this. All right. So now, since we have taken some time to settle down, so let's get into the presentation. So with the talk today, I'm going to discuss first, try to introduce what is veterinary behavior specialty. Then I will emphasize why knowledge on pet behavior is important in current day veterinary practice. Then we'll discuss about some common behavior problems. I will briefly go through them because that information is already available in ample amounts on the internet, and also so many books written on this subject. And then we will discuss about how to resolve basic steps in resolving behavior problems throughout the presentation. And then there's another important aspect I want to discuss, understanding medical problem versus behavior problems, because some of these medical problems manifest as behavior problems. So it's very important to discuss that. And then I will also briefly go through how to incorporate, say if you don't have behavior practice, how you can incorporate into your practice. And then this is my first topic, subtopic for the presentation. Actually, this is pretty much the whole take-home message I want you to take, the main message as veterinarians. Because companion animal behavior is a very important aspect, mainly because ultimately it is going to impact the human-animal bond. And when you have something impacting human-animal bond, that is basically directly impacting your business or how you perform your work, because our although how much skills and value we have, how we appreciate this human-animal bond is a very important task, being a good clinician or a good veterinary surgeon. So behavior, understanding of behavior has a very critical component into it, because most of the time, the reason why the human-animal bond is broken between the owner and the pet is due to behavioral reasons. So basically, veterinary behavior is a specialty now. Since the last 4 or 5 decades, it has improved into a different specialty in the world. However, the idea is basically understanding and incorporating the knowledge of, and also understanding humane behavior modification techniques that can be used to resolve these problems. And also there is a component of psychotropic medication. We are talking about chemicals here, you know, intervention with chemical products. So those are the, if I want to give a introduce like 3 main facets. These are the 3 main facets of veterinary behavior. So there are different colleges in the world. So I'm a member of American College of Veterinary Behaviorists. So I'm one of them. And then, so behavior and welfare goes together. So we have 2 colleges, American College of Veterinary Behaviorists and American College of Veterinary Animal Welfare. They go hand in hand because these 2 aspects are very closely related. So if we go on to discuss what is the importance to veterinarians, knowing animal behavior or this aspect of animal behaviors, one or the prime important thing is it improves animal welfare. So critical thing that we have to always think is veterinarians are there for animal welfare of the animal. So your knowledge on your understanding on behavior can definitely improve your understanding on welfare of animals. And then a big problem in Western world with behavior problems in animals is euthanasia. And I have observed this in Sri Lanka too, right? Although people don't euthanize in Sri Lanka, but many people relinquish their dogs. They just let them loose. Okay, you go and live wherever you want. So, so we have that category. I have experienced more than 100 clients who have behavior problems with their animals, but they ultimately decide to give away the animal, right, or give up the animal. So if you can understand behavior and then help these clients or prevent behavior problems occurring, then this can prevent euthanasia and relinquishment in the end. And then one other thing is nowadays the owner's expectations are high. We all know in all directions, in medical interventions or whatever the case, now the owners are expecting always more from veterinarians. So the owners expect veterinarians to know. And also the other thing is it makes your job easier and safer. Of course, we are working with animals. If you know, if you understand behavior principles, body language of animals, then your chances of getting bitten is less. And also stereotypic behaviors are the common one. You will see dogs who are caged for a long time with no adequate space. They would start pacing. And then welfare issues often rise from inability to perform certain species typical behavior. So chaining and then restraining animals can cause these behavioral changes. And also another aspect is that sometimes dog owners, they want to confirm animals to fit the society or to fit their needs. It's always argumentative in an animal welfare sense, but sometimes we do this tail docking or dehorning in cows, things like that. So some of these things can also affect their behaviors and then ultimately affect their welfare. So those are some of the things for you to think as veterinarians. But the most important parts are, like I said, it minimizes euthanasia and relinquishment. It will also increase the adaptability of rescue animals, right? And also you can decrease the unwanted behaviors if you have this proper knowledge and if you have the knowledge of understanding it. And usually, I have some US statistics here. 6 to 8 million animals are euthanized in shelters in USA. Many countries have this problem. Some countries they euthanize, some countries they don't agree. But at the same time, most of the animals who are not euthanized, in most places, they are either given to an owner or a separate person, or else they are just let out to the streets. So the problem still persists. And in Sri Lankan situation, I know what I have noticed. I did a small survey, online survey before heading to this presentation. So in that survey also many, but many out of who have answered have indicated aggression is a big problem. They have seen commonly. So I have also seen so many aggressive cases in Sri Lanka, and 3 to 5 cases per month. They are these cases that the owners are totally frustrated. But however, due to the religious beliefs we have in the country and also the upbringing of our society, they don't agree or they don't propose euthanasia, but they want to find some place to send their animals. This is again a very difficult task. So this problem and also many people who have aggressive dog who's biting, their first question is, can we remove the teeth of this animal, right? And obviously it is not possible, and it's ultimately poor welfare for the animal, and it will still not stop the aggression. So this is a common problem also in Sri Lanka, not only in like in other countries too. So having a good understanding of this is very important, right? And then also in certain medical cases, for example, like cats with urinary tract infections or urination problems, because when the urination problems becomes a complaint, a basic knowledge on feline marking can really help you to resolve the case. But if you don't know this concept of feline marking behavior, then you could spend a lot of time trying to understand or trying to find a medical problem where you will not find any medical abnormalities. So there are certain areas where some aspects become very important. And obviously the safety of the veterinarian and also the staff, right? Understanding the body language of the animal, and then being safe around. For that also, this information is very important. So if we are looking to change the way we think about behavioral problems in your pets that you encounter, first thing is to educate ourselves, then to look into research or conduct research. There aren't many studies done in Sri Lanka. I have done one study when I was a final year student, and then several other studies on behavior problems. But there are a lot more to be done in this part of the region, not only in Sri Lanka, India, and then the South Asian region. This is an understudied area. And also discussing individual cases, and then also having some outreach services. So now we'll move on to get into some information. I'm going to briefly state what I want to mention, and then you can always take your time and explore more and read more. And the content that I have put in the slides are for your later reference, where you can always read back and refer. So when you think about general principles of animal behavior, right? So the first thing is to understand abnormal versus normal behavior, right? So reflection of normal behavior from the animal standpoint, that's very important, because when it comes to different species, they have a different species typical behaviors, typical characters, right? There's always an ethological bias. There's a scientific way that we are, I don't want to use the term created, how we are as animals. So there are neurotransmitters involved, and also there are innate behavioral responses involved. So all that we have to think of, and that is species-wise, we see this distinctly, and within a species, even breed-wise, we will see these problems. And not even within a breed, but you will also see, based on different cultures and different environments, how we handle our animals. The reflection of animals' behavior will change with all these factors. So it's basically the point here is you have to appreciate the animal or the case that you see as it is. Don't try to generalize. To address that, one important thing, or the most important thing is getting a very later, take a lot of time, and you have to ask so many information, and you have to get consent from the clients, because sometimes you have to get into their get information about their private lives, you know, how they behave and how they handle the animal in the house. So things like that. So always this deep understanding of the animal, that particular animal, is very important. And these are also like human mental illnesses. Just like you go to a psychologist, it's kind of a similar situation. You need a lot of information to basically come to a conclusion. And also there are medications involved too, right? So if we discuss the nature of pet behavior problems, mostly it's a pathophysiological disorder, right? There are quite a few cases like that. You can understand there is a problem in the pathophysiology, either hormone driven or neurological, right? Certain aspects are there. Then we have, this is, I would say, the number one reason is lack of training or lack of socialization due to restricted early experiences. I will talk later about the early experiences in life. So these are very important aspects that give rise to behavior problems. Then the environmental deficiencies or stresses, and also certain intense aversive stimuli that is creating certain phobias in animals. Those type of things can also cause behavior problems. And also the other thing is, when it comes to behavior problems, certain behaviors are normal species typical behavior, but they become unacceptable for us, the society. This again, there's a give and take situation, because obviously when you take a pet, you want the pet to be living in your environment, mostly the way you want, right? And our expectations are always become important, and they are high. So, for example, it's a normal thing for a dog to go and catch a squirrel. Or attack a cat, because they have this predatory, so that becomes a problem, right? And intensity of species typical behavior, like certain territoriality or guarding their territory is a normal behavior. But when dogs are doing it most of the time at a very high intensity, it becomes a problem for the people who are having the dog, and for the environment and the neighborhood, becomes a big problem, right? And also there are certain species typical behaviors that these animals carried, and they are it's difficult for them to get rid of them through the process that we have go through domestication. For example, certain breeds like border collies or cattle dogs, they would like to come and herd you, you know. When they don't have any work to do, they still come and nip on your legs because they're thinking that you are another big cattle. So those type of things can happen. So we need to understand these are all contributory factors for behavior problems. And then when we have a problem, now how do we resolve it or try to resolve it? You know, one important way, or the most important aspect in a treatment plan, is behavior modification. So the behavior modification is a developing area, and also it has a pretty good past, like over the last 7 decades or so. This techniques has been proposed and developed. So this Konrad Lorenz, who is a Nobel Prize winner for his behavior work, he is the first one who started certain behavior modifications with animals. And most of the behavior modification is based on principles of learning. I will briefly touch on these things, but there are a lot of information to be read, so I will leave that task to you. So common behavior modification techniques include classical conditioning, operant conditioning, habituation, desensitization, counter conditioning, and so on. So these are the main principles that I will discuss briefly today, because I want you to get some idea about how we can progress if you're interested in studying this area. So habituation is basically a decreased responsiveness resulting from a repeated stimulation. So if an animal is sensitized for a certain situation, by repeatedly exposing the animal into it in a gradual manner, or exposing the animal and they are reducing their sensitization, called habituation. And then there are two techniques. One is flooding and one is desensitization. Then flooding means that you pressurize or you force the animal to get exposed to the highest intensity of the stimuli that the animal doesn't like. So this is obviously when you hear it, it looks up, it sounds a very cruel thing, and also it is not only it sounds, it's a very cruel thing to do. So if an animal is scared of something, you give the highest intensity of that scared stimuli, they're going to be more scared, right? So most of the time, this flooding is something that happens in the environment too. It happens unintentionally. But if you plan and do it, that is not good welfare for the animal. So giving the full strength of the repeat exposure, it will ultimately relax the animal. Some animals, it will happen. Flooding is a technique that still people use in animal training, especially in horse and elephant training, they use it. So, and it works also in the end. There are major welfare concerns, right? But as far as the expectations are concerned, people meet their expectations with animals using this technique. So, but I don't recommend this proposing as a part of the behavior modification plan. And then the other one is systematic desensitization. This is the most proper or the most welfare friendly and also the one that will give better results. So you identify the stimulus that the animal is scared or phobic about or reacting to, right? And then you use it as a test stimuli, and then you establish a gradient, intensity, and also the distance. You both have to consider both, right? And then you gradually increase the stimuli, and then you gradually decrease the distance through the stimuli. And by all means, in the beginning, you avoid the full stimulus. Then gradually, you get, reach into that phase where animal get habituated, and then you can use this methodology to address certain fears and phobias in animals. And then the additional component is counter condition. That means with the desensitization, you add something positive to get a positive emotional response from these animals. So when the animal is tolerating the stimulus and handling it, you reward the animal, right? And that will make the animal have positive thoughts about the whole process. And then punishment versus reinforcement. This is a very important part. Punishment decreases the chance of behavior will occur. Reinforcement, it will increase the chance of a behavior will occur again, right? So that's the difference. And again, with punishment and reinforcement, positive punishment most of the time should be avoided in working with animals with behavior problems, where reinforcement is the important aspect that you use. And so those are the main key techniques that you will use in behavior modification. You can read more about it. And if you have any questions, you can always contact me, and then I can send you more information if anyone is interested in studying this area. And then now I'm going to move on common behavior problems, right? So there are different kinds of behavior problems. I'm going to briefly go through them because time is a constraint, and also there are a lot of information you can simply read, right? So fears and phobias, the reason I am using this as my first example, because everybody thinks about aggression when we talk about behavior problems. But fears and phobias are to me is the most important one, because through fears and phobias, later you create aggressive animal, you will see an animal who is aggressive, but the primary motivator or the primary reason for the animal to be aggressive in the end is a fear. So this is the main important component to me, where if you can address this, it will help. If you can understand fears and phobias in animals, it will really help you in progressing with that animal. So fear is a normal response, right, to a threatening stimuli. Anxiety is a response to fear and agitation, apprehension when the animal anticipates a threat or fear, thinking that something bad will happen. And phobia is an exaggerated fear response. That's so this is the differences between the fear, anxiety, and phobia. So, however, the neurotransmitter involvement, and then the reaction, and then the physiologic response that the animals have, all these three components are quite similar, right? So the behavioral responses are the same. So then out of the anxiety component, one common problem that reported to veterinary hospitals is separation anxiety. In the USA, 14% of the dogs have separation anxiety, and we know through a research. We don't know how is that extent, but I have seen quite a few cases with separation anxiety in pet dogs. So basically, the animals are feeling anxious over separation from the owners, right? And the problem may be primarily hyper-attachment and dysfunctional attachment. And most cases, when the animals are not getting enough attention, or if they're getting a lot of attention and a lot of attachment with the owners, these problems can happen, right? And then the another common one is abnormal repetitive behaviors, like tail chasing, pacing, and these are mostly pathologically driven, and you have to rule out neurological diagnoses when you're diagnosing an animal with repetitive behaviors. So there's a clear understanding on how these behaviors are brought up and how dopamine plays a role in these type of behavior problems. And then aggression, what many people talk about when we talk about animal behavior. So there are, and it's the most common behavior problem in referral practices in USA, and I think it's the same here also from the data I got from Sri Lankan veterinarians. In both my studies that I did 20 years or no, 14 years back, and then very recently, we are getting same numbers. Aggression becomes the number one reported problem. And you can see there are so many different categories into aggression. I'm not going to go into all these things. Fear-related aggression, biting other people or other animal based on fear is the most common one, right? Then there's this other one we call irritable or conflict or impulse control aggression. Those are the most difficult things to resolve, right? And at the same time, you will see those two common categories. You can categorize your dogs into these two common facets. The others you can read and understand. And what the message is, there are so many different forms of aggression. When an owner comes and tells you, my dog is aggressive, should come into your head, okay, there are so many different differentials within the aggression category. I need to ask all this information to clear and focus on. And then hyperactivity is another problem that reported. People talk about their dogs being hyperactive. There's not much research, and it's a poorly documented area, but now we are seeing some research, and there are certain information showing that the brain activities and then genetical factors are affecting this problem. Then elimination problems are again often found, especially with cats. This is the number one behavior problem. House soiling, marking, excitement or submission urination. Those are the common problems you see. Then another one that I want to address, this is I'm seeing quite often in Sri Lanka, cognitive dysfunction syndrome. So this is basically an old age disease. When animals are becoming old, just like humans have dementia, they go through a similar process. I have seen within the last 3 years, I have seen more than 25 cases of this sort. So the complaint is that the animal is showing certain aspects of this disorder, whether they may be urinating in the house, they may be vocalizing in the night, just walking in the house. They can't see, they can't understand the locations of the house, things like that happens. And then most of the time, the owners report this when it becomes a really big nuisance. So this is another area where a lot of medical concerns need to be ruled out, right? And interesting problem, because it's mainly focused on associated with the age, and then the emotional investment that the owners have done with the animal is very, very big. When you see a 10-year-old, 20-year-old dog getting this sickness, the owners are devastated, right? So it becomes a big problem for you when trying to address this. And also when certain things that you propose to do also are become difficult, because the emotional attachment is very significant with the pet. So in a treatment plan that you go for behavior, so you always think about the medical differentials, right? And also educating the client, changing the environment in certain aspects depending on the problem, and the behavior modification part that I already discussed, certain aspects that you can think of, how to make a plan for the problem. And then you can do demonstrations, and also follow-up is very important in treatment plans. And now, as I mentioned, the medical rule-outs for behavior problems are also very important. I'm going to quickly move on through this section. The take-home goal message here is, when a dog comes to you with a complaint, don't start thinking it's a behavior problem. It's a very easy thing to do, but don't. You have to always think about the medical aspects or the medical contributory factors for the complaint that you are receiving, right? So there's always obviously a relation to disease to behavior, because animals show that they are sick through behavior. That's the first thing we notice is they don't eat, they sleep a lot, they don't run as they like in the past, they don't bark, things like that. All are behavior responses that we are noticing in sick animals. So behavior always go hand in hand with medical problems, right? And certain behaviors, when you see, it could be a behavior problem standalone, but always the client may be describing it as a medical problem too. So those aspects you have to consider. There are so many different organ systems, you know all this, and all these different systems that I have mentioned, I can discuss about a behavior problem without any medical problem, right? But at the same time, that should not be the way we should approach. The moment you see a behavioral change, you think about problems in the different systems in the body. I'm going to discuss two examples. One is a classical one, dermatological diseases. Very often we see them, skin rashes, most of the vets see them. And then, of course, there are so many differentials for a skin disease. Behavior is one. That's all I want you to understand. But behavior is not the one. There are so many. Behavior could be one reason. So before you conclude whether it's an ectolytic dermatitis or a psychogenic alopecia, you have to consider all the aspects of testing and then investigating into medical components in the case, right? And let me just go into this. So if you take acrylic dermatitis, there are so many medical causes: pruritus, injury, or trauma. And then also, there are certain behavioral causes too. Attention seeking is number one. To seek the owner's attention, they lick, because every time they lick, owners goes and hugs them and try to stop them. So that's attention, right? Then when they are bored, when they don't have anything else to do, and it becomes a pleasurable thing to do it. Then the compulsive behaviors, the stereotypic behaviors. And also they do it as a displacement behavior. That is, when they don't know what to do in a certain situation, they go and lick their body, right? So there is a behavioral causes for acrylic dermatitis and also medical causes. So differentiating them, and if there are no medical involvement, then you look into the components of these behavioral causes. Tail chasing, a similar one, right? Of course, there are a number of medical causes: anal sacculitis, pruritus, parasites, all that. And similarly, there are certain behavioral causes too. And then the next one I want to discuss is urinary tract diseases, especially with cats, right? So in this particular case, okay, behavior or understanding of behavior can really help you, because stress in cats and urinary marking can be a big contributory factor, right? And what is whether it's an increased urge, or whether it's a polyuria situation, or whether it's a cystitis, all that we need to rule out before we conclude for a behavior disease. Similar with neurological cases. So neurology and behavior, they go in hand in hand, because behavior is a product of neurological system. So there are certain cases, like for example, not many aggressive 2-year-old intact male dogs have a brain tumor, right? It could be mostly aggression, right? Can't be a brain tumor. But at the same time, if you see an old dog becoming aggressive, you need to start thinking about brain tumors before thinking about it's a behavior problem. So having this understanding is very important. I'm going to switch through, and I already discussed about cognitive dysfunction. So it's a relatively new diagnosis, and read about it more, because I feel with the medical advancements that we have, especially in our region also, animals are living longer. So more they live longer, most of these geriatric animals have some components of cognitive dysfunction syndrome. So the last bit, I'm going to quickly move through. I know the time is running out. So because I want to have some time for questions. So incorporating behavior into practice. So this is the last thing. If you want to, if you like my talk today, and if you want to do anything progressive in this area, the next thing to do is incorporating this into your practice. So if someone asks why should you care, the only thing is happy people and happy dogs. Like I told you, this is all about the human-animal bond. The best human-animal bond that you can propose and help, a better what you are going to be. Because nowadays, people take their pets mostly because they need companionship. In the past, few decades back, it was mostly for protection, but now it has changed dramatically throughout the world. And although I don't have any research to back this up in our region, it is the same case, right? People keep pets to be happy. So they want their dogs to be, or pets to be happy too, right? So you should care about this as a practicing vet. So, and having this in your practice, it will make clients stay with you. And it will prevent, like I told you, relinquishment and euthanasia. And owners want you to know this, and it will make your job easy, and it's always good for the animals. And in understanding wise, at least get a good understanding about this canine developmental stages. Because when you have your first puppy appointment, if you can talk about this, you already show them that you know something about behavior, and then you really attract the client to you for the rest of the life if you are doing well. So they have these transitional periods, neonatal, transitional, socialization, and juvenile periods, right? The socialization period is very important in puppies, 3 to 14 weeks in dogs, right? The rapid behavior development happens. So if you are getting a first time puppy consultation, make sure you talk about this and give them that information, right? And then they move into puberty. There are certain changes that happens at the right time when you're ending your vaccinations. You explain it to them. You will be expecting these problems in this next few months to come. And when they see that problem coming, you become a really good, wonderful person. Yeah. So, and you need to understand this and then communicate that information to the client. And then when it comes to cats, of course, we know cats, they are always different. They have their own way of doing things, but they also have a socialization period. They say it's 3 to 7 weeks. So with cats, it's very critical. You know this information and transmit it to the client. And early handling and too much handling of cats is a very, very detrimental thing for the behavior. So handling animals less than 2 weeks of age, cats less than 2 weeks of age, can have significant impact in their behavioral development in later life. So we have a behavior service at our hospital, and we see quite a few cases, behavior appointments and then training classes. So certain things that we do is we talk about preventing problems. And also we do some demonstrations for the clients. And also we incorporate with outside help. We have a few trainers who we have identified who are good and who follow reinforcement-based training techniques. So we use them. And then also we sometimes even do pre-adoption or pre-acquisition counseling too. Especially when dogs are being taken from rescue groups or shelters, they come and talk. And that's a very important area, because when someone is taking a dog from a rescue shelter or from a previous another owner, you're bound to have certain behavioral problems because the animal already has certain capacity in learning or certain information in learning. So that's important. And also discuss about how spay and neuter, why it's important, house training, socialization, how we can help benefit the behaviors. For example, urine marking and mounting and roaming in cats and dogs can be drastically reduced by spaying and neutering. Aggression to human family members will reduce if you neuter your male dogs. And so there are a lot of research in this area, which I invite you to read. And also talk about principles of training, understand certain aspects, like I mentioned before, and then talk to clients. Inform them that there is a certain wealth of information in this area so that they can also read and go through. And we do training classes, and it's very popular, I would say. I mean, not we don't get so many same time, but constantly every weekend we have these classes. And there are certain aspects that we could do, but still our country is not ready to absorb it. But understand that fact. But starting is always improve this area. And by puppy socialization, other countries have found that it totally changed the human-animal interaction, right? And it gives a better life welfare for the pet and also a happy companion to the owners, right? And also encourage, have a conversation throughout the animal's life. And if you can do that, if you can keep a track record and follow up your puppy that you come for the first appointment, you can really build up a association with the client and then the animal, and they will like it. It will always will be good for your practice. And obviously, then the last thing that I want to say is collaboration. This is collaboration among us, right? So if I talk about myself, I get quite a few referral cases from veterinarians around here. So at the same time, try to collaborate with them, discuss this, and then also if you don't know, refer it to someone who has read about it and who has studied about it. So that will help, and that will not take away your case, believe me or not, right? Because the reason is that when the client feels that you really care about the problem that they're facing, it's not a medical problem, it's a behavioral problem, and the doctor still cares, right? When they know that, they will definitely come back to you, right? So because the reason is, if it is very important we address this. In other countries, so many animals die because of behavior problems. In Sri Lanka, it doesn't happen like that. But in Sri Lanka, so many animals are kept away from homes, kicked into the road because of behavior problems. So I thank you. And that's the end of my presentation. Please feel free to contact me and we will have some questions. And I want to thank SLVA again for inviting me for the talk today. Thank you.
Thank you very much, Dr. Eranda. And sorry for the previous technical difficulties. So I think this lecture like exposed us to a whole new set of knowledge, because this is a really new knowledge even to all the veterinarians. So I think participants should have several questions. So it's time for the participants members to get clarification from Dr. Eranda. Until other members structure their questions, can I ask you one question, Dr. Eranda?
Yeah, sure, definitely.
So regarding this chill protocol, where like obviously nervous or aggressive dogs are given some chemical medications at home few hours before they come to the consultations, what is your thought and what is your recommendation, and what are your drug recommendations under Sri Lankan conditions?
Mm-hmm. Yeah, I mean, so this is a again, the first thing I want to say is standalone drugs is not the solution, right? That's the first thing to understand here, because like I said, now this is a situation where the animal is not ready to come in the car and come to the hospital, not want to get down. So it's all a stimulation. So for important thing is to address this problem with this desensitization and counter condition, okay, which I can explain. But to answer your question, yes, drugs can help by minimizing that anxiety levels. And I would recommend a drug like alprazolam or Xanax, the product name, 30 minutes before departure, right? That's the most or the best recommendation out of everything. And some people used to use azithromycin and drugs like that, but they have so many side effects. Even simple benzodiazepines can have paradoxical excitation. So alprazolam is known to be the most possible or the common drug to be used in this situation. And but again, the thing with all the benzodiazepines and most of these medications that we give, they tend to lower the learning aspect or memory aspect in animals when they are given medication. So whatever the process involved, they don't learn well while they are medicated. So instead of that, that's why the desensitization and counter conditioning is becomes the best answer for this.
Thank you very much. So any other questions? Like if you don't want to ask the question, you can type it in the chat box.
Dr. Randika.
Yep. Go ahead.
Yeah. I have seen many dogs after sterilization, especially ovulohysterectomy.
Yes.
They pass urine involuntarily. Is it only hormonal imbalance or with the behavioral problem?
This is mostly a hormonal driven problem, and supplementing them with estrogen products could resolve it. And behavioral wise, they say if you take the spaying or removing their ovaries and the tract, causing behavioral changes, yes, it can. It mostly change their behavior within their species, within the dog population. They will have problems with status in the situation, and then you might start seeing certain fights happening if you have multiple dogs in the house. That's a common one associated with spaying and neutering. But this involuntary urination is mostly attributed to hormone imbalances.
Okay, thank you very much.
Any other questions from the audience? Dr. Susantha, you are muted.
Hope you can hear now.
Yes,
Yes, I can
Dr.
hear. Thank you.
Yeah, actually, my question is now, when you train a dog by using a trainer, but then again, when you come to the owner, then will there be any negative effect? Because sometimes the dog will not respond to the owner because it has been trained by another using another trainer. So will that be a negative thing, or can we change to a common situation?
Yeah, I mean, definitely, this is a big problem. So yes, there is a impact, and it is a problem. So that's one reason why I propose that if a veterinarian can be familiar with this, and also the way how you do the training, that's very important. For example, when we do training, what we do is we get the whole family, if possible, get everybody into the scenario, and we just tell them what to do. We don't do it. We teach them the basic principles of training and learning, and they have to do it, and they have their homework exercises to do. And if they can't do it, then I say, okay, we discontinue it. There's no, because getting a trainer to train your dog is, I mean, it's possible. It is done everywhere in the world. It can be done, but this transition, we call it shaping of the behavior. Say now the trainer comes and train the animal to sit, but then now the dog has to understand how to make the transition to do the same thing for the owners, right? So especially with the way we interacting with the dog, and if we don't know how to interact with the dog properly, whoever the trainer comes and train the dog doesn't going to make any sense. The dog will do everything for the trainer, right? Because he knows either he get punished or he get rewarded. Whereas the way we do it at home, the dog doesn't understand. So the shaping of the behavior, that adaptation part is not, it's very difficult to do. So the only possible way is you get the people in the house to understand the principles of training and then do it by themselves. It works. Quite a lot of people do it now. Yeah.
Yeah, thank you, Doctor. I have another question that basically, you know that dogs are very sensitive for eye contacts, because I know I have a dog. So when I am angry, he basically read immediately that I am angry, then moving away from me. And then when I am very pleasant, and he will come and enjoy with me. So that if I use that trainer.
So you want to elaborate? Yeah.
Yeah, if you do when you train, then the emotional behavior of the person who train also will affect the negative or positive response from the dog, no? Is it
yes,
true?
Definitely, yes, of course. So now the thing is, that's why. So when training a dog, whether it's a trainer who does it or the owners are doing it, there are two main components. Whether you do punishment or reinforcement, timing is important, intensity is important. Then how the dogs will read us is the body language, right? And then this eye contact is a very important part in communication for dogs, right? And if the dog is avoiding your eye contact, that means the dog is not happy. Maybe the dog is fearful, doesn't like that situation. But if you keep on going in front of the dog and start staring and giving commands, or turn the head and start giving commands, then the dog's fear level goes up. Then the learning part is gone after that, so the animal won't be able to learn. Whereas the moment you see that the animal is avoiding eye contact, then you take some time off, maybe come up with a treat and make the environment a positive one again, and then start, right? So if you have a trainer who is very demonstrating a certain stature and aggression, then the two things can happen. The dogs can fight back, so they can become aggressive, right? So or else, in most cases, they become fearful. They will do the task, but they are doing it because they are so fearful and they are stressed, but they will not repeat it for another person. Yeah.
Yeah, thank you, Doc.
We can accommodate one more question. If the members have any other question, it's time to ask.
Yeah, this is Niranjana here. I have a small question. Yeah. Now, certain dogs hate males. Gentlemen. And some dogs hate, females. So, what's the reason behind?
Yeah. So there are a couple of explanations, madam. So the main important, or the first one is that their early experiences, right? They usually associate their early experiences with the person they're interacting with. So and this question that we see is mostly common for our Sri Lankan situation, that about the males, the animals don't liking certain genders. Because in our situation, mostly the males are not interacting with the animals in a friendly, appropriate way. Sometimes they will, depending on how they hold, and if they have a bad experience, they will start hating or they will start disliking males. And also there's another proposition saying the voice, the how we handle the voice, and then the depth of our voice can also make them feel scared. And most of the time, if it is happening to a certain gender, it's most often related to a past experience, and also a problem with the socialization.
All right. Okay. Thank you.
We have a few more minutes if there are any other questions.
And I have another question. Why do they dig holes? In the garden, they uproot plants and,
Yes. So this is, madam, again, it's a very common question, and it's a way. I mean, I have seen that as a big reason for giving their pets away, because most of the time this digging behavior happens when they are puppies or when they are juveniles. When they are adults, it subsides away. So it's a very natural behavior that the dogs are supposed to do. They are, especially if you take certain breeds like Dachshunds and Beagles and all these hunting type of dogs, they are genetically programmed to do this kind of digging, right? So it's a natural behavior that they have to do, where we don't allow it. So the option is providing them with a digging pit. You have a certain area with soft sand and soil, and you can even reinforce going and digging there by hiding some bones or toys, and then they will go there and they will start digging. They will know that this is the appropriate place to do it. And mostly it's a puppy and a juvenile thing, and what you need to do is, give them appropriate play area, no other enrichment options to avoid it.
Dr. Eranda, can I come in?
Yeah, sure.
Yeah, I read that it is basically when the dog is feeling lonely, they are going to dig holes. Is it true, or is there any relationship?
Well, it is one potential behavior that they can do when they're feeling anxious. Or sometimes even when they're happy, right? Sometimes they do it when they are lonely, like you said, because digging could be, I mentioned this displacement behaviors, a category of displacement, where when they are feeling anxious or when they don't know what to do in a certain environment, they'll start digging. You will sometimes see dogs digging on a tile floor also, right? So there's no substrate, but they still do that because this digging and yawning is another behavior who are considered as could be displacement behaviors also. When they are not feeling comfortable, they will do that. And when they want to show love and affection also, they do that. They sometimes drag a cloth and a toy and then they start digging. So yes, when they're alone also they do that. And before they lie down in a certain area, that is also they do that, because digging is a way that they do how they make their sleeping area, right? That is one of the innate behaviors that the dogs have. But now it is subsiding with so many generations. But yeah, those are the things.
Yeah, since
Dr. Eranda?
Yeah.
Yeah, Dr. Disnagar.
I'm Disnagar here.
Yes.
One more common problem we face is that dogs eating clothes and slippers and everything, especially when, right? How can we, adjust or modify this behavior, Dr. Eranda?
Yes, yeah. So this is again another common one. That's why many people give their puppies digging, biting and chewing on these objects, and sometimes biting the owners. On the owners. So this biting slippers or any two things, mostly elderly life, like juvenile life and adult life, and they might do it, right? Most of the time, this is a puppy behavior. One main reason is it's the teething. They need, when their teeth are erupting, they start doing this, and then it becomes a habit. And also, then the other thing is it becomes an attention-seeking behavior also. When they do that, when they grab a slipper and start running, we also start screaming and running after this one, right? So that becomes attention-seeking. And also sometimes for certain things that they eat, there's a taste component also that makes them do it more and more. So how to prevent it? The first thing is avoidance. If you keep your slippers on the ground, keep it on a rack or something that they can't reach, because less they perform the behavior, less they will repeat it. Then the other thing is you can make it a bad experience for them. One is you can apply some bitter kohoma or bitter apple or something like that, and the moment they start biting it, if they learn that it's a bad experience, then they will stop doing it. So those are some of the things that you can do. And the other thing is, while you avoid or stop the behavior, you have to give them some appropriate things to bite and chew on. And that's the most important thing. So with most of the puppies, one interesting thing that I have found is I have done with these many puppies, giving a small coconut with the shell. That makes them play and bite for a long time than just a simple toy. So giving appropriate biting items and doing things to avoid is the solution. Hello.
Yes, Dr. Eranda, yeah, we can hear you.
Yeah, so that's it. Yeah.
Right. So now, since this is a whole new area to all the veterinarians, we can actually, like, since there are a lot of questions, we can accommodate any more questions if you have.
Yes, my question regarding the cats, why they covered with soil after defecation?
This is
after defecation, soiling.
Yeah, the cats usually do covered with soil of the fecal materials after defecation.
why they cover it, right?
Yeah,
Yeah. Yes. Yeah. It's a question that many people ask. So this is again innate behavior that they are known to do, right? And it is there are so many suggestions why they are doing it. One is that they want to cover the smell so that the other animals can't track them. Especially males do this more often than the females. And the other thing is cats are considered, they are very clean. They tend to have these behaviors to clean themselves, have a clean body surface and environment. So in order to keep their environment clean also, they hide their species. Those are the things that I have heard about this behavior.
Any more questions from the members?
There is a proverbial saying that cats have 9 lives. How do you feel? Is it right? Cats have the 9 lives like that of vets? They have also 9 lives because they do everything.
There are so many stories. There are so many things interesting about cats. Yeah.
Dr. Eranda, can I also ask one question as one of the last questions? One thing is, now you also mentioned that you now notice more patients, geriatric patients having cognitive dysfunctions. And even like we have experienced that, like 14, 15, 16, 17-year-old animals walking, like pacing aimlessly and howling at night. So how do we like 100% diagnose it as a behavioral problem versus medical problem, and any final advice that you can give as a treatment option?
Yeah, thank you for asking that question. Yeah, this cognitive dysfunction now already in the Western countries, this has become the number or reaching the #1 reason for euthanasia of pets, right? Especially with the lifestyles that people have with apartment living and close contact houses. When your dog howls in the night, it becomes a problem for everybody. So they have to find a solution, and ultimately euthanasia becomes the answer. So in our country also now, I have clearly seen a big increase of cognitive dysfunction cases. So basically there are certain things associated with cognitive dysfunction syndrome. First one is disorientation. And then the other one is incoordination, not understanding and inability to move swiftly. And then urination and defecation inside the house, nighttime waking and daytime sleeping. Those are the signs. And then vocalization, right? And then seeking for attention of the owner. Those are the most common things that you will see. But at the same time now, some of these clinical signs are associated with medical problems. So degenerative myelopathies, so things like that can also give rise to these type of problems. Then what you need to do is first think about this as a neurological problem, and then you do a good neurological examination, cranial examination, and then check the eyes, whether the animal is going blind, right? Check the hearing, whether the animal is not hearing things. So check all that could be potentially associated with the age of the animal. And if you see that they are not, there are no associations, and also when you run your blood work, you see a very good clean blood work with the chemistry panel and also with the full blood count, then behavior is the next thing to start asking. Then you will see that there are certain patterns that the owners did not describe previously, where you will see that the dog is sleeping during the day but awake in the night. That's a classical one. And also not being able to find the way to get out from the door, or find a way to get out from the table, under the table, things like that. So when you ask those specific questions, that gives you more information about the cognitive dysfunction syndrome, and then you start helping these animals. So the helping wise, there are few things that you can do. There are some medications. So the medications are mainly directed. Seligeline is one medication you can give. It's available in Sri Lanka too. Basically, the medications are altering the brain neurotransmitters and ultimately keeping them awake during the daytime and making them move about and then active, so that they will go to sleep in the night. Because the problem is mostly felt in the night when the animals are walking in the house, vocalizing and all that. So that's one thing. And then the other thing is providing enough enrichment for these animals during the daytime, taking them for a walk, and in some cases, adding a new pet also can help, but not a good strict recommendation. But having a new pet can also help, because having a young puppy could be more for the old animal. So there are so many other certain remedies to calm them down, like certain products like lavender, valerian root, and also there's a dog appeasing pheromone, a synthetic pheromone that you can use as a plug-in device. So those are all also there, where when you comfort them with the environmental changes, then again they will go to sleep and they rest well. And in some cases, some people even use certain sedatives when the problem is very difficult, and or else hospitalization is the choice if when it's become a severe problem.
Right. Thank you very much. So I think I would like to thank Dr. Eranda for the excellent presentation and even more excellent explanations given to like specific questions from vets. Thank you very much, Dr. Eranda. And I would now like to invite Dr. Chamari Kanangara, the Secretary of SLVA, to deliver the vote of thanks.
Thank you, Dr. Chandika. On behalf of Sri Lanka Veterinary Association, I would like to extend my sincere gratitude and special thanks to Dr. Eranda for accepting our invitation and conducting today's webinar. I am sure all our participants received very good knowledge about pet animal behavior and behavioral disorders. Thank you, Dr. Eranda, for your very informative presentation. Next, I would like to thank today's moderator, our Assistant Secretary, Dr. Chandika Vikramasinghe, for conducting today's webinar. Next, I must thank our former Secretary, Dr. Sugat Premachandra, for taking the lead to arrange this webinar series. Thank you, Dr. Sugat, for arranging all the webinars. Thank you, Doctor. Next, I would like to thank our President, Dr. Susantha Mallavarachchi, and the Executive Committee of Sri Lanka Veterinary Association for your guidance and the help given throughout arranging this webinar. Finally, last but not least, I must thank all our veterinarians who participated today, even from Sri Lanka as well as from all over the world. Thank you very much for joining with us today. And special thanks goes to World Veterinary Association and Indian Veterinary Association for sharing our webinar flyer and inviting their members to join our webinar series. Thank you very much. Finally, I would like to invite all our participants to join our next webinar, which will be on next Friday at 1 o'clock Sri Lanka time. Next webinar will be conducted by Dr. Chandika Wickramasinghe about canine dentistry. So I invite all of you to join our next webinar. Thank you very much and have a pleasant evening. Thank you.
Thank you all.
Thank you.
Thank you. Thank you all. Thank you.